So to all those who are watching, welcome. Our session today will be on a collaborative approach to recruitment and retention of registered nurse in rural Manitoba, Canada. Outcomes and policy implications. And our presenters today are Catherine Baxter and Lori Fontaine. So today we have Catherine, who is currently an assistant professor at Brandon University. She completed her Bachelor of Nursing and Masters of Nursing at the University of Manitoba and her PhD at Queen Margaret University in Scotland. Catherine has worked in nursing education for over 20 years in teaching and administrative positions. She has served on a number of provincial and national committees and is currently a reviewer for the Canadian Association of School of Nursing a Credentials Program. Catherine's current research focus explores the integration of internationally educated nurses into the nursing workforce in rural Manitoba. We also have Lori, who joined Manitoba Health Seniors and Active Living in 2011 as a policy analyst charged with implementing and overseeing a 5-year, $2.8 million agreement under Health Canada's Internationally Educated Health Professionals Initiatives. Projects developed and refined under her direction involved assessment, bridge and gap training, examination preparation, and navigational support for a variety of internationally educated health professionals, including nurses, pharmacy graduates, medical laboratory technologists, and midwives. An evaluation framework was also designed to measure the impact of each project and an overall agreement prior to her arrival at Manitoba Health Senior and Active Living. Lori worked as a program developer and coordinator in the area of labor market supports and qualifications recognition in the Immigration Division and the Office of the Manitoba Fairness Commissioners in the former Department of Labor and Immigration. She continues to have responsibility for some internationally educated health professionals related programming and special projects, as well as other health forces related analysis. I am now going to pass it on to our presenters, Catherine and Lori.
All right. Okay, so the title of this is very long. So we dropped the internationally educated nurse piece out of this, but it actually was a recruitment and retention of internationally educated registered nurses in rural Manitoba. So we will use the abbreviation IEN throughout our presentation just because that's a lot to say all the time. So, and for our province of Manitoba, typically when we're talking about internationally educated nurses, we are talking about people who are permanent residents in the country and in Manitoba. So they're not here under any kind of a temporary visa. We're talking about landed immigrants. Okay, so the way we're going to do this is I'm going to talk a little bit about the history and the context and how we came up with with the pilot that we ended up doing. And then I'll turn it over to Kathy and she will talk about what we did around the evaluation and the evaluation results. So for a bit of history, Manitoba, like many provinces in Canada, has a human health resource need for nurses. And typically, I should talk about this now. Typically, there are 3 kinds of nurses or 3 kinds of health human resources that we have in the province. The predominant one being Manitoba educated, also Canadian educated coming from other provinces, but then also internationally educated, which over time has become, it's still a relatively small but valuable and important part of or source for our health human resources. Back in 2008, Manitoba, as did a couple of other of our prairie provinces, undertook a very significant recruitment of nurses that was known as the Philippine Nurses Recruitment Initiative. And it was a highly complex, very comprehensive, very, very costly initiative where the provincial departments of health and immigration collaborated and went to the Philippines and recruited about approximately 120 nurses that came to Manitoba. And there were a great deal of supports and settlement supports that were built in, as well as things like tuition supports. As I said, it was very comprehensive, designed to be successful. It occurred at a time when the pathway to nursing registration in our province was much more simple than it is today, and so it was quite a direct line from the recruitment and immigration and to practice. As I said, the individuals were supported with tutorial or tutors to be successful on the national exam, and there were a great amount of development was done in terms of infrastructure, settlement infrastructure in the communities to support the newcomers arriving. So in the intervening years, what happened is that our Provincial Department of Labor and Immigration really developed and expanded our provincial nominee program, and immigration levels to Manitoba increased significantly. At the same time, there was a lot that was happening at the national level around, because we weren't the only province that was undergoing these kinds of changes in terms of immigration. A lot of work done to take a look at how we support internationally educated professionals to come to the province and be successful. And what ended up happening, there was a lot of work done with regulators and post-secondary institutions and provincial governments, where a number of the regulatory bodies began to develop very robust assessment processes and for recognition of internationally educated professionals. So essentially what happened in 2008 could never be repeated, in essence, because now there were many more checks and balances, assessments, and then once you have an assessment, then you have to have a way to be able to fill any gaps that are identified by the assessments. So the processes became much more complex, but also robust, and all designed to ensure that public safety was at the forefront. So that was kind of a big change since 2008. In the meantime, the rural regional health authorities continue to undergo challenges with recruiting nurses. In Manitoba, unlike most provinces, we actually really have one large center only that has about 80% of the population of the province, and that's Winnipeg. And so it's always kind of have been a challenge for the regions to be able to attract people outside of that large urban center. So they continue to have challenges with that. And as a result, they continued to ask the province to repeat this Philippine Nurses Recruitment Initiative, which, as I said, for many reasons, could never be repeated. So one of the other things we began to understand is that this HHR need for nurses, we really began to understand it more as a maldistribution than a shortage. As I said, we have a number of public institutions providing nursing education, and in the province, as well as other sources in terms of other Canadian educated, as well as internationally educated. And so we realized that really the issue was really to get people to go outside of Winnipeg more than it was a shortage of nurses. And so what ended up happening over time is that we had a kind of a convergence of needs. So we had the regional health authorities outside of the city asking for assistance from the province to help them address their labor market need for nurses. At the same time, we had our provincial regulatory body for registered nurses, the College of Registered Nurses of Manitoba, and Red River College, both being concerned about a wait list for the bridging program that we have for RNs in our province. And I should just mention here, in terms of the bridging program, the bridging program is important to mention that bridging programs are by definition not regular education programs. They are meant to recognize that internationally educated professionals already come with the completion of education programs, so they come with degrees and diplomas already. And so the point is really to refresh and to fill any gaps in the differences of the competencies that are required for practice in Canada. And the other piece is that our bridging program in Manitoba, we only have one for RNs, and has been designed in tandem with the regulator, so that completion of that bridging program means that those individuals will be recognized by the regulator to meeting the gaps in their competencies, and then will then be deemed eligible to write the national exam and be entered upon the practice register. So, and I know in other provinces that's not necessarily the case, but in Manitoba, the referral for bridging comes from the regulator, and once successfully completed, the regulator gives basically the green light to continue on the process to registration. And so we have built capacity in the province, but we have limited capacity in the province to do bridging, and that is related to the kind of the other numbers of seats in the education programs. It's related to capacity for clinical placements, and so we also have the bridging program for licensed practical nurses. So all in all, we've kind of centered on this a certain kind of capacity that is typically about 40 seats per year to intakes. And so over time, because of the increase in the immigration levels, kind of fast and furious at a certain point in time, we have had issues at times with the wait list. And so that's a concern for the college as the regulatory body, and it has also been a concern for Red River as the deliverer of the education program. And so we had these two things where we both need, we need more nurses in the regions, and at the same time, we need something to help take the pressure off the wait list. So we started to think about how we may actually have the solution to the problem kind of right in front of us. So we began to look for a solution kind of internally, as we say here, from a systems approach, where we brought all the key stakeholders together. And again, we're fortunate in Manitoba because we're kind of the baby bear. We're not too big and we're not too small. We have resources, we have capacity, and we also have the ability to bring everybody together around a single table, which we recognize that we're very, very fortunate at kind of being kind of just the right size. So we brought all these individuals together. And the other thing I should say is because of the nature of the way that we work, we have had those existing positive collaborative working relationships that allowed us to come together and all recognize that we were working in good faith. We already could trust each other. We were already in many ways known commodities to each other, which also helped. So we brought everybody together and then started discussing about how we might actually come up with a solution. And so the note there is key players with a goal continuum, recognizing that each one of those players, whether it's the regulator, the regional health authority, the post-secondary institution, we all kind of have different slices of what we're really looking to get from this. And from the province's point of view, we actually saw all of that overall as partly as our goal. So addressing kind of all of those needs. Okay, so what the project was. So we had a very specific defined eligibility. In our province, what has to happen for all of the Canadian participants online, you're most likely aware that if you're an internationally educated nurse, your route to registration in Canada begins with an application to the National Nursing Assessment Service. So that had to be the first step that was already completed, which requires also having met English language requirements. It means then having gone to the regulatory body, applied to the College of Registered Nurses in Manitoba. They will have then referred all those individuals for a clinical competence assessment. And the results of that clinical competence assessment would have meant a referral for bridging. So that was the group of people, that was defined eligibility. Having gone through all that, received a referral for bridging, but have not yet, but you're on that waiting list. And then what we did was the employer was involved ultimately in selecting the participants for this pilot. So what we did was we had a information session in Winnipeg. People came. We had a very robust presentation from all the different stakeholders, including the regional health authorities, that showed not only images of the facilities that people will be working in, but also the communities themselves and all the summer and winter activities that are involved in rural life in Manitoba. And which is also, of course, an important thing to comment on, because rural in many other countries means no services whatsoever. And so we really had to emphasize that rural life in Manitoba actually can be very robust, and you have access to services, you have access to schools and churches and grocery stores and all of that. So that was an important piece to make sure that we included. So following that, then the employers, if people were interested, they put in, completed basically a what do we call it, like an intention to participate, right? And so then the employers held interviews and selected individuals and offered them a conditional offer of employment in exchange for a return of service commitment. So, so then what would happen is the bridging program is delivered in Winnipeg, and that was unchanged because it was easier to bring, most people were actually in Winnipeg, and so it was easier to have everybody start there. And then after that, they had a 4-week clinical or 6-week clinical placement in the regions, in which the regions actually helped those individuals to find accommodation during that time, so they were fully supported, followed then also by a 4-week orientation in the rural regions in their location of employment. They were provided with housing on clinical, they were provided exam preparation supports. If necessary, they were provided settlement supports. These were individuals who had already been living in Manitoba, so the need for that was less than in the previous initiative. And they were also provided financial supports in order to ease their transition into both the education as well as into settlement. So this pilot, when it first started, there was a lot of planning that went into this because we essentially started this from scratch. And I was astounded when I looked at the timeline, because we first started talking about this early in 2014. And sorry, I'm just looking for my notes about where we started. So we first started talking about this early 2014. Our first dedicated planning meeting happened in January of 2015, where we got everybody around the table and we started to really work through all the details. And the information sessions were held in September of 2015. So it took us 9 months to birth this baby of ours. So that was the planning. We had hoped to have a target of 21 applicants. We actually had 17 letters of acceptance, and 16 in the end actually participated. It was with an equal split of 8 internationally educated nurses in each of 2 participating rural health authorities. So then the bridging theory, which was in Winnipeg, these are the essential components that they're covered in the theory portion. Plus, they could have up to 4 possible online courses assigned depending on the results of their referral from the regulator. And then there were 6 weeks of clinical placements in rural RHAs. And the classes began in January of 2016, and the clinical placements ended in June of the same year, 16. And then relocation and employment. So the individuals were placed in a number of communities throughout both Prairie Mountain and Southern Health regions. Following the program completion, most of them began working as graduate nurses first. And during this time, they moved their families, if they had family members still living in Winnipeg, and began to study to write the national exam. By September of 2016, almost all the nurses had already begun working as RNs in one of those 2 regions.
Okay, thanks, Larry. So I'm just going to take you through a little bit of the program evaluation and the pilot evaluation. And the evaluation of this project was considered to be really a key element right from the beginning. So when the project was developed, the project charter was put together, there was consideration of the need to complete a good evaluation for partners to be involved in the evaluation, and the need to make sure that we put it through the Red River College Ethics Committee to make sure that we would be able to disseminate and talk about the results. And really the effect of the evaluation would be seen to be influential in looking at recruitment and retention programs and policies, looking at rural areas and how what factors would be important to help retain nurses once they were recruited. So the first thing was we thought about a meaningful time frame. The results that we're reporting on today are just the completion of the first year. We actually will be entering the 3rd year evaluation this summer, and we'll be able to sort of conclude as to how effective everything has been. But right now we have the results from how they did sort of the first year after they moved into the rural areas. The evaluation team, so it was important that it was a partnership. So working with myself as a researcher, Lori from Manitoba Health, but we also have the commitment of the other members of the planning committee. So the people from the regional health authorities, people from Red River College, people from the College of Registered Nurses, so that we can ensure that we get as much outcome data as possible. So data collection, we're using a mixed methods approach. We did participant interviews and participant surveys with 13 internationally educated nurses in the first year. Subsequently, we have been able to include all of the internationally educated nurses. So we're hoping at year 3 that we'll get results from all of them. And 11 managers who supervised the internationally educated nurses were included in the evaluation. So as Lori mentioned, we have our target initially was to recruit 21 internationally educated nurses. In the end, 17 job offers were extended and 16 accepted. And of those, just a little bit of interesting information, 7 of those individuals were single, 9 were married, and 6 of the internationally educated nurses had children. And in terms of country of origin, 14 came from the Philippines, 1 from India, and 1 from Israel. And you'll see that the vast majority of individuals had been registered for a period of time. So from prior to 2007, right up until the new grad of 2013. And the average year of arrival was 2013 or 2014. So by the time they entered into the process, into the bridging program, they had been in Canada for approximately 2 years. The majority had past work experience, and that was paid work experience. 1 had prior paid work experience in more than 1 country. 2 people had only volunteer nursing experience, so had never worked in a paid position, but had worked in a capacity as a volunteer nurse, and 1 had no experience at all as a registered nurse. Upon completion, 16, so all of them successfully completed the bridging theory and clinical. And of that, at the very end, 15 of the 16 relocated to the rural communities. So 1 individual immediately after finishing the program indicated that they didn't want to continue, and they paid back any financial support that they had received and withdrew from the program. The other 15 relocated to the rural communities. The NCLEX exam is the national nursing exam required in Canada. And so after they complete the bridging program, they are required to pass that exam in order to gain licensure as a registered nurse. 1 had actually already passed the exam in the Philippines. 9 passed on the first attempt, and 3 passed on the second attempt. So of those internationally educated nurses, we were able to say that all of them eventually were able to work as registered nurses and gain licensure. So after the first year, we had 8 working in full-time positions, 5 in part-time positions. Probably more important is the slide on your right, what they would like to work. So 10 of them were quite happy with the number of hours that they were working. They were content, and that was the right choice. 1 wanted to work fewer hours, but interestingly, 2 wanted to work more hours. And I think the relevant piece there is those individuals were already in full-time positions. So they were actually wanting to work more than full-time. And so that's an interesting piece. The majority, 8 were working in acute care settings, and 5 were working in long-term care. We're expecting that will be a different statistic when we check with them now. We're expecting that more of them are actually in acute care and fewer in long-term care. So when we look at what did they tell us, what were some of their experiences? So from the internationally educated nurses perspective, we put the the information that they gave us into a few themes. The first was choosing an unexpected path. So all of these individuals had migrated to Canada, and all of them had come to Winnipeg for whatever reason. And here they were being presented with an opportunity to perhaps move through the licensure process faster, to skip the wait list of the bridging program, but that would require another move. And so there was hesitation. Do they want to move? What is rural Manitoba all about? What kinds of communities would they be moving to? There was certainly a very real hesitation about that. But people also saw the opportunity. And I think it was really weighing up the pros and the cons. So some saw this as an opportunity to fast track through the process. Some saw the opportunity of full-time employment as a really key factor that helped motivate them to participate. And for those that chose to participate, the pros definitely outweighed the cons. Some of the things that helped with the uncertainty or helped them overcome that hesitation, they talked about the benefits of the orientation session. They had presentations about each of the regions, so what services are available, what do the communities look like. And we included internationally educated nurses from that 2008 Philippine nursing recruitment campaign to talk about what it was like to live in those rural communities and how it was to be an immigrant in rural Manitoba. And I think that those were beneficial. The first quote, when you brought in the other IEN who shared their experience in the rural areas where they were sent, it was like, oh, I can relate. And then I can see what they went through when you get there. You can see a little bit of the picture, and that helped me. So people benefited or saw that as a benefit. So that was one of the things they considered. Another topic that they told us about was easing the transition and the things that helped them. So interestingly, they had already gone through the bridging program, and the bridging program was quite successful in helping them with the theory. But there were components that they needed to still transition into a Canadian workplace. They needed to transition into Canadian nursing professional practice. And more so, they also needed to transition into rural nursing practice. And rural nursing practice can be quite different in many sense. There can be fewer professionals on staff. They maybe have a more general patient population. They may be much more dependent on the services that are available, which can be different. So I think one of the learnings for us was that the bridging program had been developed for really an urban workforce. And so when we look at one of the implications of this, is how do we build in the components of the theory that are required for nursing practice. Who they found most important, their clinical instructors, other staff, preceptors were talked about as really important. And the last quote, I think, is one of my favorite. It was talking about a nurse who had been a nurse previously. Then they, of course, became a student again. And now here they were as a nurse, and how that transition went. So it's the first time I was a nurse, it was hard because I had to familiarize myself with everybody, including the residents. The patient shouted something and they were looking for a nurse. And I forgot I was a nurse already. And the other nurse told me, "You are the nurse, go." And she was laughing. So she had forgotten that she was back in a nursing role and still saw herself in that student role. So easing the transition. Cultivating confidence. One of the most interesting parts of this research for me is that when you read about the integration of internationally educated nurses into workforces, you are continuously reading about knowledge gaps and that they don't feel necessarily that they have the knowledge they needed. In this case, they didn't talk about not having the knowledge. They talked about not having the confidence. And so they felt that the bridging program had prepared them, but now they needed the confidence to develop as nurses in Canada. So they talked about how their own growth, what they needed for that, how they gained support and needed support, and how experience and time were key elements for them in cultivating their own level of confidence in abilities. This piece too helped us in looking at the bridging program curriculum and looking at areas that they needed additional perhaps theory in. So we built in leadership, where the need to develop leadership is an important component for rural nurses. That specific piece about rural nursing practice. And also we noticed that the core courses didn't include gerontology, and that was an area that was key. So some of that confidence helped us to look at the bridging program differently. So longing, we think a little too early to say, but Lori and I, in doing the interviews, feel that this is going to end up as a really key component as to who stays and who leaves. So all of the internationally educated nurses signed a return of service agreement. And the reason we chose a 3-year time frame is that that will be the completion of those return of service agreements. So for us, one of the key things is how many people will stay beyond that. Will they stay in the community? Will they stay living in rural Manitoba? And even after a year, we would get a sense as to how connected the internationally educated nurses were to the community. So things like having places of worship, churches, or areas that were able to address their spiritual needs, whether their spouses were able to gain employment, and had they connected with the community, either the diaspora or the Canadian born community within that town or area. Those, we think, are going to be really important in terms of looking at retention overall. There was also a piece in relation to a fit with rural life. So we initially thought it had something to do with the size of the community. We're not as sure that size is important as a fit, because some of the nurses that are in very small communities have actually been quite settled. They're buying houses, their kids are well settled in school, they're joining community activities. And others that are in larger communities are not as settled. So it's not necessarily the size, but it's whether rural life is a fit for them and a fit at this time in their life. So that will be really interesting at the 3-year mark to tease that out a little bit more. They told us that other IENs, so this group, all of them set up a Facebook page and they are in regular contact with each other. So they have the support of each other and they're a very strong cohort. They also have the support from other internationally educated nurses that had been recruited previously. So other IENs were considered to be their primary source, followed closely by their nursing colleagues, their preceptors, hospital orientation, and then the educator and the managers were also identified as important supports. Bridging programs, so 11 out of 13 found the bridging very helpful in becoming registered. Interesting, one of the 2 that indicated that it wasn't very helpful was already registered, so that was a non-applicable. 12 out of 13 reported that it was very helpful in adjusting to their first position, and only 1 reported that it was somewhat helpful. So bridging was something considered to be a support. The financial supports, 10 indicated that the financial supports were a factor in their decision to participate. So the payment of the bridging program, the relocation supports, they were very important and were sort of part of their decision to participate or not. 11 out of 13 found them very helpful and 2 out of 13 found them somewhat helpful. So bridging and financial supports were important. So what did the managers tell us? So these were individuals that were directly in supervisory positions over the internationally educated nurses. The first is that the managers also talked about cultivating confidence. And again, they all identified that the internationally educated nurses were competent and their knowledge levels were good. Their language levels were good. What they needed most was confidence. And so it was how to build that confidence, how to give them enough support, how to individually assess what a nurse needed. So some nurses might need additional shifts with a preceptor. Others were very confident at a very early stage. And both Lori and I were incredibly encouraged by the amount of time and investment the managers put in supporting the internationally educated nurses. So when they needed more support, they went out of their way to try and provide that support, with the idea that that would eventually help with the long-term retention of that employee. They also recognized that time was needed. So some of the confidence would come just with time working in the areas. The managers also talked about culture and the need to consider culture. So it was talked about in reference to English language. So English language skills and abilities, the language levels had all been met. So it wasn't about understanding English language. The issue was speaking English versus their native language in the workplace. And that was quite an issue when you had two nurses from a particular culture talking in a different language other than English. That was a challenge for the managers. Patients and other nursing staff found that difficult. So they talked about that. They did not identify communication issues with communication with patients or communication with other health professionals, but they did talk about the need to develop confidence in that. And also to be aware of colloquial language. Family responsibilities. So many of the nurses had families, and they did talk about the need to balance off shifts. Daycare opportunities in some of the rural communities weren't there, so sometimes husbands and wives had to ensure that someone was available to provide childcare, because those additional supports from extended family may not be present and daycare opportunities may not be present. And they also talked about their commitment to the employer, that they were very committed, that they were willing to do extra, that they were certainly, they were wanting to be successful and wanting to succeed. And lastly, they talked about supporting integration. And I think the managers really saw that this was a project that helped meet a need. They needed registered nurses, and this was a way to get registered nurses. And so they were invested, and they were willing to provide the supports needed. They did see the integration as a two-way process. So they saw that they would provide opportunities to the nurses, but the internationally educated nurses had a responsibility to also ensure that they met their obligations and that they worked and tried to identify areas that they needed to learn more about to fill those gaps wherever they might be. And the managers really did reach out to the internationally educated nurses. So they met with them, they talked to them, they tried to adjust supports as they needed. And the interesting question we asked the managers, you know, what would you view success and how much support is too much support? And they were really incredibly positive about if a nurse stays for the return of service, the 3 years, even 2 years, they feel that that is worth the investment. It's worthwhile to put the time and energy into trying to support them in their practice. So that was a real positive.
Okay, so speaking of keys to success, so the policy implications of all of this work. I think the most important thing to say, one of the things we identified right at the very beginning, is how crucial it is to be able to clearly articulate the problem we were trying to solve, right? And coming at that from different perspectives, but putting it all together and then very, very clearly identifying what is it that we're trying to solve. And then, you know, how will we know what success is? How will we know if we've actually succeeded? And so something that's very important, I think, around this piece for us is to mention again that context, is that it was very, very important for us to be very clear that this was a response that addressed this need at this time in our province, right? And so even from the first time to, because since this, which we'll get to, but we've done there's been a second intake, we have made changes, you know, and so as things change or as we become aware of things, the need to always be flexible and nimble enough to address the needs that are presented to us. And so we also were got very, very concrete in our plans. Our working group, at first we started to try to think, okay, could we meet by teleconference? And we had one face-to-face, and then we had a teleconference because people had to come from these regions. We started off with even having vice presidents of HR attending these meetings that later on became solely attended by their delegates that were there also from the beginning. But we kind of fine-tuned that working group over time as we start to build greater clarity and trust amongst us in what we were doing.
So I think we'll have to sign off because of technical difficulties. So I'm just, because people can hear me on my end, I just would like to thank Catherine and Lori for sharing this information with us. It was very informative. Thank you everyone for attending and for the presenters for their great presentation. Everybody have a great rest of the day, and thank you for participating.